And that the T1 through 7 is here. Then and then you come around the front T7 would be right about or T8, 9. Come on, let's just go back. So I'm going to start here. I'm going to palpate along here. Side. None of that. So much for that. So let's go to the other C1 through 7 is actually T1 through 7. It's like you drop those down. So I'm going to palpate here, T1. That feels good. Okay. Then the lumbar ones are on the crest. So I'm going to palpate here. Well, maybe you don't have it. Is that? Well, we tried. Thank you. So that's the technique. Now, if we'd have found one of those points, we would have gone to the spine, challenged and adjusted, and then adjusted to love it, used the respiratory.
So it will always be a loving relationship with this?
With this protocol, it seems the Lovett is the one that will provide the most pain relief. The idea of you're trying to calm down this visceral spinal pain pattern. So iliolumbar, one of the reasons I wanted to do the gait test was to kind of review that, because we're going to do a backward gait test to find the iliolumbar. This is one of those, Dr. Wally used to say that he thinks a lot of problems with the iliolumbar ligament are related to IRT. He's seen a lot of iliolumbar ligament problems clear with IRT. So I don't know. Anyway, it will show with backward gait testing. Make you too dizzy. Here's the ligament, and it goes between the L5 and the crest of the ilium, and it's kind of in front. So it kind of tethers that TP relative to the annulment. And the idea is it can be injured, and then it goes into contracture, it goes into, it's adhesive, and then it locks up, and then it changes your gait, because that's a key pivoting point in gait. So someone come up who has a regular gait. Somebody with a regular, worked on Dr. Charles. We got his gait to normalize as long as he held his jaw up. Okay, so first we're going to do a regular gait. Now, you guys remember session 1, session 2, I think. Muscles need to turn on and muscles need to turn on. Right. And so for example, right forward gait, my right upper trap, my right anterior deltoid, my right pec, all inhibit to allow my shoulder to come back. So my right piriformis inhibits, my right glute inhibits. On this side, my left lat inhibits to allow cross wall. So those are all normal inhibitory patterns, and if they don't inhibit, then we go looking first where the dura attaches, upper and lower, and we try to find what is interfering with that normal. So anyway, so we test the patient in neutral, shoulder up. wrong. Now, we haven't done any other clearing on you today, so we don't know if it's switched or if it's cranials or any number of things. Let's check its lab. Usually the upper trap, that lab, if the, now that's, it feels like there's something on the shoulder. So that, we won't use that lab because it's kind of weak and clear. And that one's kind of weak, so we won't use the labs. The other one is the SCM. The upper trap and the opposite SCM inhibit with, those are good. Okay. So I'm going to ask you to step forward with your right foot. Just stop. There you go. Now I'll kind of enhance their gait a little bit. Bring your shoulder up. There, what should happen? It should, yeah, and it does. That's good. And we won't test the lats because we know they're not to be trusted. Now we'll go this way. There. Oh, no, just like that. There you go. So SCM, that turns off. But does it? And enhance the. Yeah, there it is. Now come back. Left forward gait. So the opposite should happen. Shoulder up. Head over. There. Head forward all the way. And that inhibits. So that's all normal. That's good. Now, what if those didn't inhibit? We start TLing. Occiput C1, C2. We start TLing the sacrum, the nominants, and we start there and look for a problem. Maybe categories, maybe cranials, maybe. Now, we're going to test him in backward gait. Now, it's the same thing. So instead of stepping forward with his right foot, bring your right foot back. And freeze. Keep the weight on the front foot. Do that again. Now, step back. There you go. So, bring the foot down. There you go. And this knee down. So, now, same thing should happen. This shoulder should come up. Head over. And it inhibits, and it should. Okay, and bring this forward. Inhibits, no. Okay, bend a little bit more on the reason I'm having bend more is to create more proprioception. There it is. Okay, good. All right, so step forward again. No, step forward. With both feet. There you go. Now step back with your left foot. So right knee bent. There you go. Go. Forward. Over. Okay. So he may not have it. Well, you don't have it. Right. So he doesn't have it.
This is different from if he's stepping back on stepping.
It's supposedly different. Supposedly, it would bring up a problem with the iliolumbar ligament that just reaching forward doesn't. That's how it was. That's the best answer I could give you. It seems to work. Now, he was clear both front and back. So anybody else want to let me check the gait? Now, I checked the forward gait because I wanted to review it, but you can go straight to backward. We don't know anything else right now about her. But, so shoulder up. Nice and strong, shoulder up. Strong, good. Let's check your lats. And lats, very good. SCM. Yeah, so everything seems really intact. Step backward with your right leg. Stop. Now, left shoulder up. Now bring your head forward and over. She doesn't inhibit. Now let's have you come forward. Come backward on your left leg. She doesn't inhibit going back, so that's seems to be bilateral. Okay, Let's just enhance that a little bit. Get forward. Oh, she's locked up. Okay, so now what do? Let's have her push forward on the L5 area with your own hand. Yeah, just push forward right there. Okay. Now, shoulder comes up, and that normalizes it. We can go real thorough, and that's normal. So that's positive for iliolumbar. Now, that was with this gait. Come forward, back with the right leg. Now, we push forward on the left side. Shoulder up. That doesn't show there. Okay, now, put this hand up here on your upper cervicals. Take that in. Get in the gait position. Okay, so that's upper cervical. You don't know what yet, but there's something. So go ahead and push forward on that. See, she doesn't have iliolumbar on that because that doesn't negate, doesn't normalize it, but she has it on the right side. So how do we treat it? I'll show you how we treat it. A lot of times, if we do good work around the pelvis and lower lumbar, a lot of times it'll clear it before we even have a chance to find it. Lay face down, please. So you look for, a lot of times there'll be trigger points in the upper glute max. Is that tender? Mm-hmm. It is? Yeah. Yeah, I can actually, that's kind of ropey through there.
And I had pain when I pressed into my back on that side.
Okay. So right here, if you guys want to come up here, I can see what I'm doing. I'm Heather. I'm Heather high water. So I'm basically going to be reproducing the pressure that she put to normalize the gait inhibition. But I'm going to bring her leg into the glute max test period, now position. Now now is that any less tender?
Oh, no.
No, it's about the same. So I'm going to get on that L5 lateral mat or TP, and I'm going to lift this up. I want you to contract your glute and lift it like we're going to test it. Breathe in and breathe out. Good. Do that about 2 or 3 times. You okay?
Yeah.
It's like a respiratory correction on it. Throw in a little more. We throw in the glute max thing. And we come up. And we'll just retest. Okay, now this shoulder up. Shoulder up. Okay, now step backward with your left foot. Good. And right shoulder up. And not so much. Bend that knee a little bit. Oh, okay. Push forward again. We get it more specific, right?
Right here.
Yeah, just really.
Is she on the SP?
She's on the TP. Yeah, we just didn't get it. Lay face down. Didn't get it. I say, see, if I didn't have that test, I wouldn't know. But I send her out the door. Now she could have something else. She could have a tattoo here. Let's make sure we're not working through too many layers. Touch here for me, just a single-handed TL. Doesn't really show. Do a two-handed TL. I'm testing for cat 1. Okay. So maybe we'll clear a cat 1 first, and then it'll. So she's got a cat 1. Tell me what to do next. Cat 1. Cat 1 experts. Cat 1. Two-handed TL. two-handed challenge. So where's my blocks? I got blocks. So I'm either going to put the blocks this way, right? What determines that challenge? So this kind of looks like it's a little more, so I'm going to start with that. So I'm on her PSIS and behind her ischium. And that doesn't show. So that does. So challenges this way, I go this way, which is interesting because just if I would have just gone by palpation, I would have probably thought this needed to be this way, but that's not how it challenges, or not how it tests. So yeah, so this way, double check. So we're going to bring in block opposite to that. So how would I know if the blocks are set right? Strong, but I might have her TL. Right? TL for me. Both ends, because it's a category 1. So it's right now it tests negative because at some point the hamstrings will go weak, and or the TL will cause it to go weak. Cause the TL. And the body will be telling me that enough of the block. So how long do we? Good rule of thumb. Never more than a couple minutes. Cat 2, Cat 1 could be, Cat 2, probably 30 seconds. Cat 2 doesn't clear in 30 seconds or so. Either your blocks aren't right or you missed something. And then there's times where you can block them Cat 2 for 5 minutes and you still have to put on their side and give them a proper adjustment. So, there. That's good. Sure both of them are weak. So she's going in. So go ahead and just TL that too, just so you can see. So keep your hands there if you would. Take the blocks out. And now we have a negative TL. If we wanted to be super thorough, we have a negative challenge. So Cat 1's clearing. Now let's check your gait. See if, because I thought we got that ligament pretty good. Okay, so step backward with your left foot. Right shoulder up. There it is. There it is. Come forward. Step backward on your right foot. So that normalized her gait response. Iliolumbar, but then she had the Cat 1, which kind of brought it back. That's the kind of thing you'll see. I was hoping it would be a simple, straightforward, iliolumbar, but no. Any questions about the iliolumbar? Any questions about gait testing? Know your gait testing before the written exam. Know the basics. What inhibits and what doesn't. It's pretty obvious which muscles have to turn off to allow. Okay, so that's iliolumbar. Are we going to do lunch? Is it lunchtime? Is that appropriate? Okay. Yes. Who else? Somebody else or just you? Anybody? You guys all did.
No, he did not.
I had 14 people. I counted them up last night. 14 people took it, that's awesome. And you guys all did. The areas where I thought you were weak, hopefully I told you. All of those skills.
We're doing.
Yes. Is anybody going anywhere for lunch? What? Tacos and sushi?
Yeah, I really like
They don't put sushi in the.
No.
Okay. Oh, that's an interesting confused situation. What about anybody going to
Stress receptors.
Huh?
I can do that.
Stress
Well, only if somebody else.
No, but I can go get it for him.
I just don't want to go anywhere. What do you want?
A mixture of these things.
Oh, you know, the standard chicken shawarma and hummus and salad thing. I can't remember all the rice, salad.
I found a better place than the Princess.
What?
So, okay, well, I like more authentic, and that's like more
Agreed.
Yeah, that would be great.
And I asked Ada and a friend asked before he left, and he said they're green corn. I disagree.
That is not more authentic. It tastes good, but it's not more
It doesn't even taste that good.
Maybe it depends on which one you go to.
Like, I bank on Middle Eastern food being full of flavor.
Yeah.
I mean, I want to taste every single spice at amplitude.
Ooh, you know what else is a little bit disappointing? So my mom wears a CGM. We went there. Yes. Yeah. Thank you. We went there and we had their Euro meat.
Maybe I
Pretty sure they put and their seasoning. I mean, I know it's a common thing, but it's like I still don't like when people do it. You know what I mean? For them to like put sugar in their like spice mix.
Yeah.
But her glucose was like high.
It helps cut some of the grease and acidity.
It's like yeah, but like no also.
I don't get that because I love it. I think it's delicious to say, but I don't taste the spice. I just feel it's like a complimentary thing.
Yeah.
I don't.
What?
I've heard that. I've heard that before.
And then it's a topic, so it sounds like shawarma.
I'm
It's everywhere.
confused. Anyways,
Yeah.
what place do you like?
Hold on.
So I found it when I was
So,
down in
okay.
one quarter
We'll go there.
by Dr. Porter's office. It's close by, and it said I saw like it said Middle Eastern restaurant, and I was like, or Mediterranean, I think is what they. And I was like, oh, okay,
Yeah,
I'll
I'm really
go.
excited.
It's really new and it already has
You know,
like,
we
a couple
lost,
sign. And I was like, oh no. The guy was
son,
so nice. They have
when I
like
was
chai
doing
there,
a
which is
class 3 years
I don't know
ago,
if it's the same type of chai that I
when
like, but like we
after
call
our very
it Turkish
last
chai.
class,
I remember.
I was next morning.
What's it called? Do you know?
No, but I can find it.
Yeah.
But if you have any allergies to seasonings, I would ask because I think the rice has like a little bit
Changed
of
my
like
flight.
nutmeg, starting something like that. But it was
Anyway,
like
long story
I
short.
don't have any allergies
Oh!
to anything.
it was so good. It was like kind of nutty seasoned
Yeah.
rice. I loved it.
That's
Yeah. Have you ever been to?
And then the tomb, I don't think I should have dairy in it. 'Cause at Green Court, I'm pretty sure they cut it with dairy.
I feel like they're just kind of sketchy over there, if I'm honest.
I know. I was like, all the Middle Easterns come over here and like lay down a bunch of kids, but you make the crappiest food.
Yeah,
I know
was
we're
not-
American and like we think we can't handle spice.
Yeah.
Have you ever been to
I don't
Keto?
think they have any gigs.
No, but I've heard it's pretty good.
It is. Yeah.
There's one over by ASU. It's on the campus.
I
And
know.
My mom, dad, and I stumbled upon it one time because we were all
Is it
starving.
like a super small place?
I think so.
Like the halal guy or something?
I think that's it. Yeah.
Yeah, I've been there a few times. It's good. Yeah.
And practices.
Yeah.
So much fun. Yeah, I love it.
That's so.
I took the Japanese visual
I need to.
series.
Are you still leaving?
No, this is healthcare systems. He's
Who is it?
Mr. President.
Yeah.
I know, that's why I was like, just kind of looking at you.
Yeah.
Like,
Atlanta.
That's just why I look at you like that. What is this? Oh, I was like, what am I doing?
Okay, that was what I was just doing. Like, why am I zooming out?
What did I write? Honestly, I don't even know what I'd be doing sometimes. The only thing that's left in the power is cranial stress receptors. I feel like he said something about going back to TMJ. Oh, I think he said we were gonna do elbow. Something about that because this morning he said he wanted to do that, but it wasn't enough to show up. Is what he said. He said that.
That's it. So. No, it's complete. But I did enjoy it. I only had one thing. I wish I would have gotten I wish I would have gotten the kebab instead of the shawarma.
I usually just get like years, but I do like kebabs can be like hit or miss.
I never get. They did have lamb there. I love lamb. Just didn't get it because it was a little expensive.
Yeah. Was it like what do they use?
I always had dumpling.
Yeah.
We make it ourselves. I don't like my parents come from. I don't know about. I think if he had a
Get a what?
skin,
Is that
like you do the pita bread and then you hot tomato sauce over, and then hot spiced butter. It's great for the acidity of the part of the tomato plus the butter. I had it as a kid. You also can do like a sauce, like a yogurt sauce over
yeah.
and all me, my mom, and my sister all were about to fucking. My dad's like, I'm doing great. Like,
That's usually me when everyone's like, I'm doing well. I'm like, I don't know. Why? I like to make jokes and say I have like a stomach of steel.
oh, or just something big. Because I'm doing I want to eat more like the eat right.
Yeah.
Because I think that's actually pretty much what we do.
Yeah.
Days just supposed to be more vegetarian.
That's annoying. That's why I don't like stuff like that. Cause I'm like, don't tell me I can't eat meat. Like I'm fine. Leave me alone.
Honestly, like as long as I have chicken, which is one that's okay.
Yeah.
I'm okay. But like, she started tonight.
Really? That's crazy.
I know.
We just had steak the other night. I had steak for breakfast yesterday, actually.
I never want steak for breakfast, but steak
Yeah.
and potatoes
That
for
was
dinner.
literally all I ate yesterday morning. Steak. Yeah, that's all I went all week. So I'm glad you reminded me because I totally forgot again. What? So a lot of other people. I mean, I also didn't pay $5 to be here, so I can really shut up. Fair.
Only my second, the first weekend last really an hour, I think an hour and a half.
Yeah.
Sunday because I had that test.
Oh yeah.
Every other time I stayed.
How was that? I'm kind of excited for that class.
I loved it.
Who is it teaching it?
Oxford.
Oh.
I think here's my favorite class.
She's like haunting me already. I'm just kidding. So do you think people think that her shift is hard because most people find TCM like very challenging?
She does not do that much.
She doesn't? Then why do people think it's like so like
I just
daunting?
depends on the population that you're seeing. On like my Monday shift, we don't have that many acupuncture. Maybe the shifts will have more acupuncture.
Yeah.
I know John's had a few.
And like what's
She's
the
not
problem
warm and
people
fuzzy,
have?
And I think that's either gonna make it or break it for people.
See, I don't have an issue with that.
What I don't like is that she doesn't really teach you. In
Yeah.
class, she's a great teacher, and on her shift, she's not. She figured out, or you should know that. Why don't you know that? Go look it up and tell me what you think.
Honestly, I'm gonna put some good energy out there, and I'm gonna pray about it because I do really well with like modulating myself and like not like saying what I would want to say, but like stuff like that really just grinds my.
It's worse now that I'm a Q, the Q10. Okay, fine. But when now that I'm a Q15, basically need to be perfection and know everything.
Yeah, because I'm like, if you expect me to remember everything, you might get an attitude out of me.
You have a long prep. Do you do the assessment? Do you do vindicates, treatment plans?
Yeah. So like normal prep.
That was not normal for me because I didn't like none of my other docs had me prep until
Yeah.
Q10 asked her out. She's like, "This is your prep list." And I was
Oh,
like, "Frick."
that's so funny.
It hasn't really been common to have doctors do the prep.
I feel like, well, that's so weird.
And it's not that I was aware of. When I was getting ready for clinic, a lot of the people I talked to were like, "Oh, only a few doctors prep."
I mean, I guess so. Maybe I think that's weird because I've had like multiple doctors that do
Like
that.
Dr. Botley was a resident when I was.
Oh, she does that.
Now
we
she
do
does.
like a lot of like regular stuff.
Yeah, now I know you guys like she now has
Yeah.
she has her own.
She has a whole situation that she likes to go by.
Yeah.
All righty then, so let me get, we're gonna do you, well,
Sure, I don't care.
are you guys familiar with endonasal?
And nasal,
Endonasal,
we've done it through the mouth.
that's how it,
Oh, okay.
Let's see if you can fix
Endonasal.
my drainage.
Oh, you asked me
You
about
did
that,
it on
good.
me the last time. I thought I was
I'm gonna
dying.
go home to take my dog.
is that you I did them?
Not like this,
Thought it was
not this
L.
session, but
Thank you.
last session.
I'll be back.
Like
did.
last
Probably a
session
little
isn't like the last time we did this, so like 2024.
Oh, I did, on you?
Yeah.
Oh, okay.
Oh my
I think
god.
I remember that.
Did it help?
Were you in that one?
Yeah, I think I remember it.
The
I-
50-hour one?
I did one
Oh,
on
not that
Ella
one, no.
last
Oh.
month.
I'll have you do it, but in the 50-hour one, you did it on me.
Okay.
I've never had so much hot putrid fluid.
Oh.
I didn't even think my ears were that bad. I was like, sometimes.
Did it drain well though?
Oh yeah, my throat was just sore for like 30 minutes after. From
Oh, that's not too
how intense it was. It was great though afterwards, and
You
I
had it done before?
No.
Let's use this entire table.
I do want to know how you do it again though.
I'll show you, I'll talk
Okay, wait,
through it while I do it.
Aaron, is you talking about the eustachian tube thing?
Yeah.
Oh, I thought you were talking about something else.
Both sides. Nobody has an otoscope handy.
Actually, I think if I have one, I might have one.
Is all your stuff in your
Is
car?
there with your tape measure?
I keep all my rhinos put in there. Should I?
Even your blood pressure stuff? Is it like wrecked? Weird.
I'll take it out now. It's getting hot.
Want me to
Friends, I did that
CC
last
it or-
summer.
I'll go ahead and lay it.
And it's like
So guys,
fine.
if you want, I can talk through this while I do it. I think, so, let me go up a little bit higher. So, normally I would take my otoscope and take a peek and make sure it isn't hot. It's a good idea, make sure it's not like. So what I'm gonna do is have you over. I'm gonna do a little scouting mission. Come in here. So that's where I use it. Baby says, did you hear that? I Okay, I can feel it. So where I'm gonna go is just on the soft palate this way, and then like a soft sort of, it's like a little, like an open, it's like a mouth. They got a name. Oh, it's way behind. It's back. It's way back. It's like the worst. So when I do it, I'm gonna relax. And so nobody's talking. Nobody's speaking. Yeah, nobody's speaking. Sorry.
How?
It's not the worst. That's why I do the worst one first.
I wasn't expecting that.
No, it's worse than you expect.
Oh, yeah.
But I got in there. At
Yeah.
first, I was close to, I had to go.
What if somebody has like a really bad like gag reflex?
You can't
Can't do it.
Or you have to anesthetize.
Have you ever had somebody throw?
No, I haven't, but I've had people gag a little bit.
Oh, I sounded like an exorcist when I sat up because there was so much fluid that I had to sit up and
And it was me that did them? I don't know why, I've done so many.
I'm
I
glad
guess-
you don't remember.
I guess
it
they
was
don't get-
traumatic.
yeah.
Everyone was like,
I've had people
What's
get
going on?
pretty, I've had people, spit up mucus and blood and all kinds of things.
I
You need to-
still don't know how.
That will drain, because I can feel it.
I can feel it, yeah.
You want me to do the other side?
Yeah.
Okay. I'll lay you back.
You're great. You
Get
are
it
great.
done.
That one was worse. I could hear it. Like,
You have water.
Yeah.
Make sure that's good.
Okay.
Maybe step on some more tea or
Cool.
something. If you spit out a little bit of blood mucus, that's
Oh.
not normal.
It's okay. Here you go. Hold on.
You're a hardy. Oh, look at that. Did you get something too? Yeah.
I got all of them.
Full on. Oh, that's, I'll probably, because those are all moving. I love them. You know, I've been eating like a horse these last days. I don't know, what's going on? I seem to be eating more than normal and I'm not having any trouble digesting. But, yeah. You get the same thing?
If I pronounce it Fatouche.
From the same place?
Mhm.
Oh, cool.
Pelican Greek salad.
So it's interesting how Greek food and Turkish food, this princess Lebanese. It's like the food system to me.
So they were more Palestine.
Oh. Must be like potatoes in that part of the world.
Could you fly back?
Well, I'm actually flying out tomorrow morning to Tennessee to spend the week with my daughter. Not fly back the next Sunday.
Oh, fantastic.
Yeah, so this was the beginning
Start
of
the
the
road
vacation. Yeah. I'll gladly get you one again. I don't think a week off since Christmas.
Ooh.
Yeah. I keep telling myself I'm going to take at least part of a week per month. But then that doesn't always happen. Or I have the idea, oh, say, I'm going to take time off, but then I go look at my schedule and it's completely. So like, instead of having to move everybody, once in a while, I'll forget to tell my office manager I'm moving on to such and such, and then I kind of think it's way, way off, and I go look at the schedule and it's like, oh my God, she got completely. So, trying to learn that. Daughter wants me to build her one of those backyard storage sheds that you buy a kit. You can steal it. So she's got one picked out, but so that's part of what I'm going to do out there.
That's vacation, building the shed,
Yeah.
the storage.
Well, a couple of years ago, I built her a deck out there. Spent like 2 days and built not a real big deck. I have my suitcase full of drills, level, took a large suitcase. This time I only took my drill because she's got everything else. She has a neighbor that has a saw. But that's it. And you'll do just about anything. My daughter lost her husband. So, my trips out there to visit her now usually involves some kind of settlement involved. But she's got a new man in her life. Really nice guy, I really like him, but I'm not sure how handy he is. We'll find out. He's going to help me on the shed, so we'll find out what is.
That's the qualification.
You'll see how. Yeah, we'll see how he
Build
does.
the shed.
Yeah, I have a feeling
He's
he's
in
going
the
to get.
surplus trust.
There you go, the circle truck. How's he handling the wall? He's a nice young man. But, you know, it's hard. Her husband, Billy, is just weird. Yes.
Oh.
Yeah.
What was he?
Although she's just now 40. And no real risk factors other than he had a couple of. But esophageal cancer. Diagnosed with it right at the beginning of COVID. June, July of COVID, we got that of 2020. And then we buried him in May of 2023.
Bless you.
No. Did not. They were talking about it. But been great a few years. $2. And granddogs are like great kids. They're actually good. You play with them, have a good time, and then dad goes with that. It's great. Barbie, like, it's great. I'll take him. He's a lot of fun. He's a fire hair carrier. High energy is just not 6, but he barely was out of it.
They're like, for big dogs, they dog bodies.
Oh, yeah. He has no idea of proportion. In fact, one of his best friends is Klaus. Klaus is large. Biggest guy.
Parents have a Jack Russell, and it won't get along with any same size or smaller than. She's a complex. Like a big dog.
Barbie does really well with other dogs if he's like taking to the beach, he's just fine. Probably decent height. But his home, and somebody walked by, he just comes up. And they don't know, like, nobody's able to figure out. He's just.
That's the button.
Yeah, and then he calms down. And he has this really, he has a bar that really turns it off. Literally, you feel. Maybe. He's just the sweetest. Perfect family. Let's go hide. Such a little ones. What terriers were they bred for? Still trouble.
Fun fact, my dad has to tell everybody.
So one of my friends who's passed on now, who I bought from, he was a retired man. He'd done a lot of time on TV work. Well, he had, that was the, he'd been a, he served in submarines, you know. And then he been in the nursery. Somewhere along the way. Anyway, he had several of them. I met one of them that was a skipper. So they're actually almost.
Huh?
They're almost.
For you, probably. Because you like burn, don't you?
He said they were bred, they were bred to be.
And it's times where I think I
they
have
went
to
on
look
barges
into
and
some
then-
cancer screening.
Oh, yeah, I've seen these.
Show me what you're looking at. I want to see now.
It says here Amazon. I think it's on Amazon. I'm like,
You're gonna look?
Don't look
trying
like
to
a
support
dog.
Amazon. There's certain things I'm gonna get from there.
Yeah, it's just a little.
Because I don't know if it's good quality or not.
And then,
Yeah, you need it.
yeah, there,
It's 48 and it's kind of
he had this one.
My issue is it doesn't have really put a new machine, but like, I don't know. I'm just gonna use it for walks. I'm hoping to get it, I should have gotten it before
earlier.
I know that's what I was thinking.
So I can go to the beach. I was like, figure worst case scenario, I can just, when I'm in San Diego, just buy one. But I'm like,
That's true too.
it's always more expensive out there.
That's so true.
It's the name of the food.
Yeah, literally try to get it before you go. That's the good thing about Amazon.
Kind of look like a mini.
Sun,
The old days, Mark.
legitimate sun. Oh, they have salad bar.
Puerto Rico, Casper. They should have an outdoor park for the cats. There's cats running around all over the place. They would do the
What?
pest control.
I don't get the point of sun hats that have your scalp
So
exposed.
cats are.
It's if you have a ponytail.
Yeah, but feel how hot this is.
We had barn cats.
Is that normal?
I grew up.
I don't feel it.
Literally,
We had our,
I think my
we had her
freaking,
two that lived in.
whatever that
That
house
feels
was
normal.
cat, and then we had this population of cats.
But my hands might be hot. Then.
Were sort of settled
Oh, yeah.
there. They
So
lived.
I'm like, I don't know. I feel it.
ever since my
But you feel cold though.
I blistered.
We tried to
Yeah,
catch
that's
it and
not
they
for
loved
you.
the stuff, but they were pretty much.
I mean, you know that, but
And they had a
freaking
short
hat, like he said. He's like, we're going out of the water. Like, you just taking the kids with you. And I was like, or you could have just
They
done
kind
your
of-
job.
no,
Checked on your
actually.
white ass.
And they got run over.
You would?
Why?
Yeah,
People why?
there's lots of coyotes.
At that point in time, I'd already been burned, so.
Yeah.
Oh, we're gonna go on that 2-mile bike ride.
I don't know
16
if the
miles
coyotes
later,
eat a cat.
I
They
would.
probably would.
Yeah, I mean, he doesn't burn, does he?
You know, if they caught it.
He does eventually. He doesn't like it.
But it like takes a long time, probably.
Yeah, take him significantly longer. Takes him,
Yeah.
like, being outside in the sun for most of the day.
Exactly.
Takes
So that's
me
why I was just
about
like
2
thinking
hours.
about his complexion.
Big mops out here.
Because I'm like that. Like I can be outside all day, no sunblock. It's fine.
You guys have the problem with the.
Okay.
It's not my
Steaks
fault.
too buttery and juicy and lovely and cooked just right.
It's not my fault.
No, it's not.
I didn't do anything.
You're built to survive. I am not built to thrive.
No, you're built to thrive in
More of a.
Some of them are cute.
like not sunny climates. That's where you're built to thrive.
Anywhere
That's why I
from-
have thighs that don't ever separate. They're meant to be in jeans 24/7 surrounded by snow.
We even
Exactly.
saw there
The
were two
friction,
stuck in
that's
outside
where you're meant to
But
thrive in cold places.
They have broke
Cold
down, but if
climates.
you see them with the little piglets, they're very.
I've heard that they're real problem. I sometimes I have YouTube searches, but I somehow stumble across this guy in Australia.
But you know, that's nice too. Sometimes I like miss cold weather,
And he goes
but
out.
sometimes I want to be comfortably like bundled up.
Areas
Yeah. Like I want to wear pants and like coats and stuff.
I'm excited to go to
The guy just
because I'm gonna get me some Blundstones or Thursday or what is it, chocolate issues. I have been wanting, so I thought I was gonna get to go to Montana for undergrad or for DPT school again. Obviously I'm going.
Thankfully,
You do a lot of damage to crops.
at least for me anyway.
They're really.
It's been
They're
nice, it's been
invasive.
good.
They're not nailed.
Where's the Chelsea shoes? Give me the like.
Yeah.
Don't do.
I would love,
Like they're good.
I
Like
would love to have some
There's all kinds of
like the
stuff.
boots that were on that previous page, but it's
Wild
like
dogs.
it's too hot out here for that.
Those are good. That was jeans and a big sweater. Oh, it's gonna rain and I'm gonna have a cozy little latte.
Are you gonna be
Sort of
sad?
bingo guy.
Sad about what?
And those are
Like, do
really.
you get sad?
No.
Like, seasonal
No.
associated depression?
I get that in summertime. I always had, even as a kid.
Really?
I was
Yeah,
the,
you're built for that. You're
I
built
was
for
the
that.
10-year-old kid who's like,
Versus.
Because I wanted to go to natural Catholic school in Washington, but I was like, I can't. I'm gonna be sad. It's not gonna work.
oh no, I think I'll do that. I am happier and better
Well, I'm
off.
glad you're going there then.
Yeah, everyone's like, oh, just wait, it'll take a few years to catch up. And I'm like, maybe, but also probably not.
But probably not.
I felt like summer schools as a kid. Not fun.
Because if you get sad during the summer, what does that mean?
We saw them.
Yeah, like I don't know what else that means.
Nothing else can hurt me,
Yeah, I don't know what
I
else
get
that's
burned.
supposed to mean.
and I'm sad. I could get more cancer, or I
It's
could
double
just be
trouble.
depressed.
It's double trouble for you in the
It's-
summer.
We have some curves in southeastern Oregon.
I'll pick my bad ways. And
No,
that
I think
is,
I think it'll be
What?
it'll be perfect for you.
We kind of keep the
I'll have
herds
to wear
in
more,
check
bring more
because they
socks and
do a
shave
lot
with socks.
eat a lot
Who
of
knows?
foliage. Eat with the deer and antelope, hey.
You,
Of course.
UPF of 80 miles.
What?
No,
What is that?
horses,
Oh, that's
horse
a big
herds get
scam.
too big, but
It might be, you just don't know these days with people.
they don't
This
really
is one
vet the
from-
Disney version of
made
wild
from
horse.
premium
You'll
paper.
see the
But
actual
what
wild
is
horses.
it?
They're-
That? Oh, premium paper.
I'm
Still
thinking about
premium.
paper.
Lose all the traits that
Um,
mankind have bred
is this
into the
legitimate?
horse, the big haunches and the
I
long
don't know.
bodies,
They,
beautiful faces. Those,
Oh,
those
you wanna-
revert back
when I'm shopping for something.
generation after generation, and you can see these wild horses that have
Good reviews.
really abnormally large heads.
On
compared
four,
to
oh,
bodies. Their backs are kind of
14,000
sloped.
14,000? What do they have?
They're not very
It's a
big.
4.5.
Oh, yeah, that sounds,
They don't fit
that sounds
the,
legit then.
movie version.
It's only $23.
That's it? Oh, is this one?
Yeah. No wonder you were like, is this a scam?
I like to go to the reviews and see if like other people posted pictures, because sometimes like these pictures look amazing, and then like the review pictures look like trash.
Beige or khaki?
But I probably khaki.
I don't know.
Which one do you wear?
So like lieutenants over here and then this,
Sometimes
that,
I
and this
think
one's dating.
I've been
Like,
neutral
I mean,
on tone.
Really?
it's
But I
actually
think
quite
Wear
fascinating.
like gold.
I think
and, like,
khaki
the
will look better
red
on you.
undertone that I have in my hair, maybe a
Oh,
little
and so,
bit more light.
along the Salt
Whereas
River.
like the brown and silver. maybe a
No,
little
I'm
bit
saying
more
that
washed out.
there's
But
volunteers
everyone is.
that actually go out, I think they
And right
do
now,
once
I
a
have a
month,
botched
but
highlight.
they don't do
I
the
don't remember what.
welfare.
Have I seen your hair like you're
So
talking
they
about?
get,
It was red.
Yeah, have I seen that? I feel like I
I think you
haven't.
did.
Unless I just don't remember.
No, remembers, which I'm like, dang, guys.
I mean, that's not you. I don't think I.
but I've been looking for them
I
I
don't
don't
know.
for
Blushes, I
years being out here.
That's all that
They're
matters.
fun to watch. I
everyone's
remember
like-
one time we were
some
watching
people
it
liked
down
it,
in
but Jonathan
Oregon
kids
some
could see
years
it
back.
because it's dark and the
Yeah.
It was out, it's kind of late in the day.
I think
and
I
they were
just,
out grazing on the hillside.
Like sometimes if I'm not in the presence of someone and I try to think about what
And
side
the
or like some
stallion,
features on my face, I can't remember.
main stallion.
I just wonder if I'm actually looking
The
at
poor
people.
guy. Everybody else is grazing.
Honestly, I'm not expecting you to remember my
Circling the herd,
like that.
looking like this. Doesn't get a bite to eat
It
himself.
wasn't
And
smack
all
in
the
the
other
face
workers
red.
kind of doing their thing. It was amazing, I thought.
No, I think I do remember.
I wouldn't want that job.
It was like
I think I do remember. I remember us having a conversation when you were outside
They
and
were
you were
calling
like
him
in the
the
sun.
lieutenant.
Oh, okay.
It was like a soft
He was
under
always here.
red.
Everyone else
loved
was
it
doing
because
their
that's
thing,
what
he was
my
on
hair
lookout.
as a kid.
And eventually, some
And then
young
it became more
stallion's gonna challenge him.
sun-kissed
See-
blonde red.
See if
Maybe
they
you should do that again.
Yeah.
Especially
So
if you.
they
That's
have
what
to
this
worry
is
about
supposed to be.
challengers,
Honey blonde.
Did you get a
predators.
different person to do it? Was the same person?
Same
Or was
person.
it odd?
It was when I was really sick of the movie scene.
So the
And I
romanticized
was, like,
version of the
dying.
stallion
I do
is
remember
not
that.
the same as.
Like, I can
They're
reach
get
it.
short,
I can reach on
hard,
cigarettes,
stressed.
and I was like,
stallion.
and is that how it went? Oh, I could barely speak. I had no voice.
Imagine humans,
I
our
was
lives
really
are
alone.
short.
Watched me here, and I
Oh my
messaged
gosh.
her, and I was like, I'm gonna go back to Arizona, and then she's like, that'll be an additional $65.
Oh
And I
my
was like,
gosh.
no, I already gave you
I had a similar experience with a lady. So I had this lady that did my hair expenses.
You're 30 years old, you're.
She did my hair for like 6 years.
So,
When I got
where we
my
at?
hair
Are we
so
ready?
long, I was
I
trying to
can't
clone
trust
a
that
lady,
clock. Is that right?
and I don't know what came over
Clocks
me.
here
but
all.
her. She was supposed to trim my hair. She cut my hair, and when I realized how much like of my hair she cut off, I like went back and looked at pictures. I was very upset. I'm still kind of mad.
I'm really tempted to get my hair like chopped right now,
Why?
but because it's overstimulating. But
Okay,
if
I
I
can
get
see
it
that.
cut an inch, I have to grow it out to my lumbar, and then I can cut it back up to here, and I'm like not a super short.
Does your
bob.
hair grow fast?
I think so. That'll be fine. And that way I can, because I'm gonna try to
Areas that have.
Oh, I
so
see.
I want to get
Okay,
it a little like longer, like
so you can do that. Yeah, well,
Yeah.
you should do that. And then
but also the idea of having that long hair makes me want to just
if you're already overstimulated now.
yeah. Maybe when I have sweaters on and I'm walking
Yeah,
around
when
in
it's
the
like
winter.
cold, that's when. Yeah, that sounds like a better idea.
I am always making it through the summer because I have winter.
If it's rich,
Which even then, I have no idea. I'm
you
moving.
want to sustain.
I was gonna ask if you.
I have
If it
no
takes
idea
a
what the
little
plans
while,
are.
sometimes.
You know, that's okay. I feel like something will come about, and it'll be amazing.
It's kind of cute.
Oh no, it is cute. But they had good reviews, so I felt like it would be good.
Interesting.
That's the way to do it. You go in on the stuff that, there's certain things that you can really feel. And then,
Oh, I should print out this thing.
but then, that opens the door. If you just go from straight to, like, if they're not at all familiar with this testing, any of this stuff, and you go straight from A to Z, and you're doing emotions and homeopathy and all this, you might lose it. But you can fix a job.
Who did you say was tutoring you for homeopathy for boys?
My mentor, Castle.
Then
Council.
you got.
That sounds cool.
She does a lot of energetic stuff.
Ooh, she does.
Yeah, so she does the demos and does the biotherapeutic drainage.
Cool.
Which I used to take great against. Now I'm just like, this gives me an opportunity. Yeah, yeah.
So there's
Oh, this is
only
probably not
some
something for you, but I. What do you?
Let's see. Where do I find? Where do I find this
So.
teacher request form? Is it under like
What's going on with the wrist?
the?
Oh, that's.
Is it under the Simone Clinics thing?
Yeah.
Oh, yeah.
Probably have seen it. I just don't remember. Let me see.
Then they're so surprised that I know something. And then they'll say, you're not like.
I hate the way everything is like so hidden. We have to like
There's a lot of them that they know, but they're not.
go search on them.
Look. Yeah.
Oh, here we go. How do you know if they have a glycerin? You just like reach up on the thing.
So I would download it and then at the bottom.
Just kidding, here it is.
Yeah.
Couldn't get into it.
I always forget about the little tab.
Tried it in chiropractor.
Formulas. Oh, that's cute.
And,
Ooh.
the
What do you think
guy
about this?
had
I
all
mean, I kind of
kinds
want to make my own. I always get nervous about stuff that has licorice in
all
it.
kinds of fancy.
Should I be nervous?
No.
No.
It would take a second if you.
I was gonna say that. That was gonna be the next thing.
Because I forget, I can find where I did the math.
And
Like,
I
okay,
didn't
what's the
see.
active like dosage that
saw a slide
increased?
twice a day.
I did.
How's it going?
Well,
Yeah.
Now it's like 3
but
weeks.
that was because I was having that's my sister.
Oh,
And even then, it's still
I mean, I would see that.
didn't do anything.
well, it could raise and it didn't cause any like hypertension.
Yeah.
But he got impatient.
Dude, this one seems cool. I think I saw
So
this
one
one.
of the patients says, oh, you're gonna.
The Adrenal Tonic by WWH.
Drop dead or retire. Okay, good.
You could also do, since you only do 6.
For some of them, I'm like, yeah.
I think I was thinking about doing 5.
Good idea. Let me help you.
That's what I was do like, do just 2 small ones and then you get a big one. So that they can mix into different like amounts. I think that that's because you can only do 4. So they would do
Oh, yeah.
3. And that way they could do 6, but now I can do 6. And I
Yeah.
think you would need
I
to.
also feel like it's like I get it, but for me, 6 almost feels like a lot. Unless it's like a lot of different like actions you're trying to cover. I guess it just really depends.
No, is he a member? I see.
Or maybe I think it feels like a lot for
There's a lot of
this.
people doing AK this market.
I think so, yeah.
AK job extraordinaire.
Well, I guess I'm gonna do 6 then.
I'm just saying, if it,
No, you're right.
the efficiency is the main thing.
Train AK, they do AK, but they just don't want to.
But I can put it in there.
You don't have to by any.
No.
You can try the one that you want, and if you're like, hey, I like it, but I want to change something,
That's something I didn't like.
then add that or take it out.
No, I can put it in
We have
there.
most
If
of
it
the old
helps,
guard,
it helps, you know?
I kind of came up with. Not many of them left. We lost 2 last year, 2 of them. 2 of them. Wally and David Lee.
Yeah.
He died last year. Cancer. Prostate cancer. That was, I really liked it. It was kind of a
He had a fun strength and say,
Oh, he did, yeah. You know, if he got on his good side, he was, I thought the first 2 or 3 years I was in the ICAK, I thought he just didn't. He wouldn't even look at me. He would just like, we're.
Sounds like a
And I thought that.
like they just don't.
Worthy. Then I'm in this meeting.
I still can't find what I.
And we take a break, and I'm all around, and he comes up to me, starts talking to me, like we talked about some issues that we're talking about. And he's like we've been friends for years. I was like,
Also, Tracy, I'm just gonna keep bucket hat.
You could. Bucket
I
hats is
love
no,
fun.
not at all. It's just, he didn't have anything to say before. And then from then on, I was like, then I get to sitting on it. Did you meet David when you, in 23? Yeah, he was darting around. And it was what happens to students who don't.
Please print the form and sign.
Did you? Did you go to
Do they
this
care if
talk?
I like handwrite this?
Yeah,
Oh, you're on the.
yeah, you went to this
Do you
talk.
have the? They not have the Steve.
Oh, I thought this was that.
He had
The thing that I clicked on
you
said
know, that's the
student.
thing, you
It
don't
says
need to
it.
be so smart.
Oh, okay.
That's why I was like, this better not be the wrong
Part of
thing.
who he was,
Old one then.
he did so much, he was so much part of the IC. Still is, and he's still, he's still a big part of it. You know, I don't know. You do have any, you have some differences. A couple, three. Yeah, yeah, mostly, the US chapter is mostly those things. But we're getting more and more, because of this, more than anything, this particular program, and somewhat the one that's been going on. That's why we have, that's, other than that, there's, you guys have been, of the ND members, you guys have been primary. Your program here is pretty unique. And also, one of the long, because a lot of the schools have K clubs, but they kind of fits and starts. You get somebody, you get a good group in there that's really, and then they graduate off, and sometimes it falls flat. Good L. I saw L was like on every.
Yeah, we're both on SJ.
Yeah.
You know, can't just do one thing.
Yeah.
But yeah, that doesn't tend to happen.
Well, it hasn't. Every year, I taught here the first time in 2018. And prior to that, there's been somebody teaching there. Yeah. And the AK club at Western States has been really good and then practically non-existent. I don't know where it's at these days. And they had one at the college there. And then one of the main docs that years ago, she practiced for a long time, and she lives down here somewhere. She practiced there. She's in Carlotta Walk. So I don't know where she's at down here. She's down here somewhere. She moved down here a few years. I think she still goes by. And then there's another guy named who's a nature guy. He's actually he moved down here. I don't think he's practicing right now. Yeah. That's where divorce. Is Carlotta on there? That's her. Yeah, that's her. Yeah, she's big in it. She's big into, she does a lot of emotional work. Yeah, check her out. Tell her I said something.
Yeah. I don't know if she does mentoring, I know she used to. It's hard. I've done it in the past, and it takes a lot of energy. And then if you're going through, I haven't done it for 2 years, you're going through issues, office, staff issues. It's just too much. Yeah, but, I know when she was still in Portland, she
So that'll
did
give
some
them time to
mentoring
study,
because the neighbor path
go
was
home,
down the
go
road
eat,
from me.
and then go work.
And she
That's my
actually
second
did a
study.
preceptorship.
iPad and check.
That's what I was gonna ask you if you do
And
that.
she ended up working with,
Do you like?
and then she.
I used to do that. You know what really gets me? When people like read books on the treadmill.
Actually, my current, my new
Like,
office.
I can do like a Quizlet or something, but like whole reading, that's crazy.
I've been writing notes, physiology notes.
That's cool.
So are you in with, another contract?
Yeah.
But you've got your own.
What
You're not working for them.
No.
You're just doing it.
No, but like actually,
Sharing over.
that's so valid.
And he's a.
Honestly, it seems to me stuff like that seems dramatic, but I like it. When I'm like, exactly, that's why I like it.
Wait, Alice, hi, how you doing?
Hi. I'm exhausted.
Really?
The burrito put me to sleep.
That's why I ate my just like one chicken.
Yeah, it was really good, but at what cost?
Do not sleep.
Hi. Well, yesterday was Nina's sister's graduation, so we stayed out to the bar until 1 or so.
I'm gonna make dip in 25 seconds. Something called.
It's like that.
It's her graduation, and she doesn't have
Okay,
You were.
that makes more sense. That's fine. But I'm like going
I
off
know. The night before that, I fell asleep in Nina's lap, and then she kicked me out, and then I had to go home because she was in North Phoenix, so I went to sleep at 1. The night before that, I went to sleep in the sunrise because I was with a high school friend, and I was gonna like go home at like 2, but then she started getting really concerned. I was like, I need to stay here. And it's just been downhill since then.
You take care of yourself.
I know. And tomorrow we have to wake up at 6 a.m. Choose stuck in labs.
It's not.
I will
that
not be
deep, girl.
doing that.
It's not that deep. You're gonna have a lab when you're gonna have a lab.
What are the options?
It's like Tuesday morning and Tuesday evening.
Tuesday morning it was 9.
You won't have that because you already have
Exactly, that's why it doesn't matter.
shift. When's your shift?
I mean, mine's gonna be Tuesday evening.
Your shift?
My shift.
So
Oh,
you're gonna
mine's-
have Tuesday morning.
That's what I was like.
Just sleep in.
Yeah, they're gonna have to put me in the second one, so it doesn't even matter for me.
Like everybody.
I was like, at some point, I stopped real quick. After,
Yeah, I decided I wasn't doing
too far. I was
it.
like, whatever. I really don't care. I have to have one, and I'll make it.
Yeah.
Why are there 2? So the lab is for emergency medicine?
Yeah.
I got
What do you mean? Oh, it's just split because you go to different sections. You go to like, you'll have like divide up into 4 groups when you
To do what?
in emergency medicine.
We're doing group work? Gross.
Yep.
Oh,
Group
that's
4.
fine.
Is there someone in your cohort that likes to be they're more outspoken?
Sorry, I ran out of.
If we're in a friend group, no, we all hate it.
If we what?
It likes to be outspoken.
Well, in your cohort.
Do you need one person?
Because there's like a few, like we like to kind of pick on some people, what makes them really, or like do things.
I mean, I feel like we
Try
have
to
a lot
be
of those
funny,
kinds of
just
people.
people's
It's just
attention.
not us. Like a good thing or a bad thing in this situation? It sounds terrible. If you
I
ask
didn't
me.
really enjoy their presence, except for Evan. If Evan's there, he's like slightly attractive. Well, you guys will, neither of you will find him attractive, but like my whole group is like oohing and awing over him.
Why won't, okay, I need you to elaborate. Why won't we find it attractive? I'm just curious.
Not a woman, and then also.
Wait, I'm so confused on what's happening right now.
like him.
I'm so confused on what's happening right now.
Well, Alice not gonna probably find him attractive. Oh, okay, 5%.
I'm just really confused on what's happening right
Then
now.
I still don't think you would get that 5%. I feel like
You
you
think
have
that's
better
lesbian?
standards. Probably.
you read my?
Well, that's what I'm saying. I'm still.
I'm just really confused on what's happening right now.
I'm just saying you guys
I'm
probably-
ran out of insulin.
No, not
Oh.
that. I'm thinking about her.
I was like, I'm filling up my pump right now.
I'm watching videos ever since it's done.
This
I learned
is
something.
a very much lazy way of doing it.
No. So I said YouTube would like him because I didn't know Elle had like 5% preferences for him. So I was like, not a woman. And then also she said, I feel like so too. So I was like, well, he still probably would fit into criteria. For you, I don't think he would fit into criteria because he has a couple, like he's got a butt.
Oh, okay, thank you. That's so
And the New York accent. And he's like 40. But he's got a great sense of humor. And he's like somewhat slightly like the little sense of humor that you're just like,
Okay.
he's one of the emergency medicine guys that comes in. He's chill.
Oh, you're saying he's like a doc.
Yeah, he's an emergency.
Dozen different chiropractors you get.
He's chill. The rest of the guys.
I'll let you know when I see him. If we remember.
It's like
what you mean. I feel like we're gonna remember what you're talking about.
You gotta
A
be
40-year-old guy with a beard that may not fit into.
Okay, for either of us. Okay, I get it now. It makes sense. Yeah,
He's like
it's
not
adding up.
genuinely that attractive. Like his personality makes him just the slightest.
It makes you think about it.
Yeah.
Okay.
Yeah.
Yeah.
Entertaining is really because like
So I
he's
think
calm, he's collected, he's chill, he seems
I mean,
kind.
those are all nice things.
Yeah.
we should get started. Is it time?
Yeah, that's tough.
It's almost time. Yes.
I just keep thinking about
Not
what you
us, who?
Kayla's on there. Sorry, Kayla.
Yeah, just listening to the whole thing.
I didn't look up. That's what I have to say.
Guys, I'm gonna start. We're still a little thin. I think a couple people had.
I have to go, but
You have to go.
Dylan's leaving.
We didn't get tackled your jaw.
next time.
Next time. Okay. Study hard. Okay. Now we're down to the true Dago taste of aliens. So, anyway, I know all of the muscle slides have cranial stress receptors, and I think this last time or the time before, I apologize. I said, hey, look, here's what cranial stress receptors are, so you know what's popping up on slides. But this is a group of slides that goes into a little more depth about the cranial stress receptors, and you could think of them as an area that in the skin and fascia that gets basically damaged to the point where the myofascial matrix gets disrupted, which is kind of what an IRT pattern is. And it will involve often the neurovascular reflex sits on that. Like if you have a stress receptor, usually they're lines or they're circles, and if they're found, they'll often be associated with an active neurovascular reflex. So when you have a weak muscle, and actually, how we so as that we couldn't get turned on.
I have 2 weak QLs that don't turn on.
You have 2 weak QLs? Wow. You were having to pull back then. So, what's that? Pull back for QLs. It could be. I don't know. We're going to have to find out. So, I have some slides that have all of the stress receptors on one skull. But, basically what we do, if anybody can find it in their slides, let me know. I can't remember where I have it. It's probably in a different session, but someone come up and we'll just do, I want to see if someone has a weak muscle that we can use. Weak muscle. Is that? Is it on there?
Yeah.
Oh, okay, good. So I'll go ahead, slide 20. Ah, yes, there they are. I thought I put those on there. It's too late at night, I didn't realize. Okay, so this gives you pretty much, is there one more? Yeah, so these 2 slides give you pretty much all. So let's keep those up there. And here's what we'll do. You guys take your own hands, touch your own skulls, and just kind of see, we'll start with these two. See if you can feel any tenderness. And if you do, make a note of it. Maybe we'll do some testing just to prove that these things actually use it. We got a bunch of lines here along the occiput. Got lines going this way. These will have most of them will have a directional response. I got one. So, anybody find anything? You got one? Let's see if we can experiment with it. Where is it? Right on the side. Okay, have a seat, please. So on the left side?
Yeah,
On the right side?
Oh, yes, right side.
So right here? So that's right about where, what does that say, track? Middle and lower track. Okay. So let's just see by testing middle track. That's pretty good. Now lower track. Nothing. Okay, let's try this side. She switched. Oh, those are fine. Okay, so let's just kind of tap along there. That's where the tenderness is, right? And there we get these. So we got lucky. So now that we've kind of zeroed in on that, let's go to this side here. I'm going to use your del. Okay. There. Now touch that tender spot. There it is. Okay. So stretch. It's pretty much it's like a horizontal thing. Push that way. Push this way. Push this way. So you can go two main directions and then you can sort of vary it. So breathe in and hold. So I would correct that. Take your hand. It's right about here. So I'm going to correct it by pulling back as she breathes in. So breathe in. I'm right over her temporalis too. And you can see my hands kind of sliding and dragging the. So, yeah. Good TL that. Just tap it. See if that doesn't show now. So, is it any less tender? Say.
Maybe a little bit.
Still tender. Yeah. Still fine. Touch right where it's tender. Let's see. It doesn't tee up, so I would move on. Do you have any others?
That's the only one that I found.
Anybody else have a tender spot on their skull? Where's that? On top? Right, right there. Ooh, right there. To the right of the sagittal suture. So what would that be? That would be up near the the hamstrings or glute max. Lay on your neck. We'll do supine hamstrings. So that's what I would call a kind of weak hamstring. Try this side here. And pull that. That one's better. Kind of bring it down a little bit. Okay, those are just a little mushy, this one especially. Now touch right where that sore spot is. Take your hand away. Okay. So that definitely makes a difference. So, is that crossing? That right about here? So that's about where. About that. Now I want you to touch there. I'm going to find. Wait, before you do that, I'm going to find a strong indicator. Go ahead and touch there. Okay. So forward. Back. Go forward. Breathe in. Okay, so same thing. Got lucky again. So I'm going to go forward as he takes a breath in. There's not much muscle up there on the top. It's mostly fascia, but the fascial elements, of course, connect eventually with muscle. Tensioned, tethered. Now hands to your side. Now if that's the only thing affecting his hamstrings, those hamstrings turn right back on. Now that one's still, now that's pretty good. Yeah. So that was thank you. That was a great example. Okay, who else has got a sore spot on their skull? Shot. Where is yours at? There. Oh, okay. So it's tender right there. So that's right at the back, at the little sulcus there, at the mastoid processes on both sides. So that you know, we could have. That's right where the SCM. Here where it attaches. Forward, all the way over. Turn this way. And it's not too bad. That one's really good. That one actually is not, he's really strong, but that's actually, if I really give it a little, that's not. Okay, so let's have, it's kind of hard to do that, but if you can touch that, then come forward. And so that would be, now, those are kind of more of a round thing. So the way, so I'll go to a strong indicator. And I'm just going to go here and I'm going to twist it this way. Right on that little, maybe a little high. That's where it feels kind of that way. Yep. Okay, so breathe in. So far no exhale. So breathe in. Close. It's like a screwdriver. It is kind of boggy. Okay. Okay. Yeah. Yeah. Head forward. Does that make your sinuses drain a little bit?
A little bit, yeah.
Okay. Yeah. See, that's much better. Yeah, that's really crisp. Thank you. Yeah, these things are they work pretty predictably. Thank you. So it could be considered when you have head trauma, when you had any kind of surgery, if you had a chronic issue with, like, say you've had a chronic tight / weak SCM that allows aberrant neck and head motion. But any of those things can cause these stress receptors to come out. Now, I really think they're really kind of fascial lines. They kind of follow the fascial stress lines. So they're worth checking out. This is the protocol find a weak related muscle, which we did TL for the reflex and retest for strengthening. You find a phase of respiration that reverses the strengthening effect. We didn't do that. We went weak, then went with what? Strengthened them. It's just like with any challenge like that, you want the body to be okay with, especially with skin or fascia, you want the body to be okay with moving in a variety of motions. It's not causing flood of apparent. Linear tug, that's what we did. You can tug around until you find the maximum degree of pressure, about 2 to 3 pounds. That's about what I did, right? Okay, that's the last slide on that group. Okay. And Mel, can you take me back on the see what we have left? We're in, surprisingly, I was really concerned about getting through everything, and we're in surprisingly good shape, unless I'm missing. I went over it. What's that? Okay. I really want to make sure you guys feel like that. Now, how do you feel about high level turning or esophageal? So that you feel like you can find them and fix them. How about ICD? I know it's not this weekend, but we'll see about it. You guys are dialed in. How about gait testing? Forward gait, backward gait. How would you? Beautiful, powerful tool. What we did was a couple of sessions ago, we did with Elle and with Tiana. We all did the cross crawl thing, and all the rest of us stayed strong or strengthened a few things, but 2 of us, everything blew out. Remember that? And then one of you was an ET and the other one was sacrum or something.
I wasn't any.
You were the other one. Yeah. Anyway, do you guys remember that? So, does that make sense? Do you feel like you could do that? Use that on a patient? So the gait testing is excellent practice because there's a lot of different muscles you can test, and you get a sense of how these muscles are turning on and turning off. So it's a great thing to practice, and you'll find things that you won't find in it. How about ocular lock? You guys all feel like you got ocular lock? Go over ocular lock. Hey, Dr. Charles, like. Back to pain. Shape type. How is it? Now you guys don't change. You don't do Mount or United States. We're at the same time this time of year, West Coast. I'll run through ocular lock. You won't find test questions on it. And I would be happy to I'd be happy to demonstrate anybody. Well, see, we talked about bent bone. Anyway, Dr. Charles, why don't you come? Did a lot of stuff on you a little while ago, so
I want to see if, because I want you to feel ocular lock, because I think you probably use something similar, but now I'm going to have to see. You can do ocular lock in any position. If you get a finding in one position, go back to the test to see if your correction made a difference. Make sure that you test them in the same position. So ocular lock, basically, you find a strong indicator muscle. The PMC is a really good one if they're supine. We use delts here. So keep your jaw relaxed. Close your right eye. Close your left eye. Eyes open, up to the right. Up to the right. Down to the right. Down to the left. Nothing. Absolutely nothing. Now, relax your jaw. Okay. What's that? We didn't do right and left, did we? Okay, eyes to the right. Eyes to the left. Relax the jaw. His jaw is really quick. It's the quickest. It's like, instead of quick draw, he's quick jaw. Quick jaw. See if we can get those to do that. Once again, and eyes to the left. Jaw relaxed. So that so eyes to the left indicates what? C2 on the left, probably. But then you'd want to go back and do your challenge, right? Or you could have the patient do a good TL, right? Patient TL and relax your jaw. That doesn't really show. Let's come back a little bit. Take a thumb and put the thumb right here. Yes. Show. So lean back. So test it to the left. So we'll check the left C2. There it is. So he just needs a pretty firm hand when it comes to challenge. See that deep? Okay, so I'm going to do a respiratory on his left C2. Is that okay? Sure. So where's my pressure going to be? Where's my vector going to be? Be the same as my challenge. Vector and my placement and my contact. So breathe in. In. Breathe in. Breathe in. And let's go. See. There we go. Spring that on, get that. Didn't get to move much yesterday. But it'll be. There we go. Hard fought. your neck. What's that?
I said I'm not making it easy.
Yeah, you're and eyes to the left. Eyes to the right. So it led us to C2. Just a C2, now it doesn't show. That's ocular lock. Now, eyes up and to the right. Up and to the left. Occiput on the left. Down to the left.
What's that? Sacrum on the left. So can you TL your sacrum? On the left. Eyes down to the left. So, so we're going to adjust his sacrum based on ocular lock. Oh, there we go. My hands are dry. Or at least we're going to use testing to see if the sacrum TL. So we'll see what it needs. Have you had any issues in your low back I should know about? Discs or?
Early on, a couple times, I think I've herniated.
Long time ago?
Yeah.
Okay. So I'm going to challenge the sacral base P to A. So I'm going to challenge the other side, P to A, just to be on right. So left side, breathe in deep and hold it. We breathe out. Hold the breath out. He actually strengthens on a breath out, first time. So the corrections will be very basic. Just sacral base. I'm going to just rock it forward as he breathes in. And then out. Sorry, yeah, used to doing it breath in. So breathe in. And then breath out. And as he breathes out, I'm basically encouraging sacral extension. And if you had a drop table, that'd be a good time to go there again. Push, push. Challenge, challenge, challenge. We have you sit up again. First thing we found was C2 and sacrum. Down to the left. Doesn't show. Eyes down to the right. Doesn't show. Eyes straight up. Straight up. Relax the jaw. All right, thank you. So, ocular lock. Now, that won't be on your test, unfortunately. But you'll use that in practice. A lot of different things like that. They're just absolutely funny. Just absolutely so predictable. So when you have a gait issue, if somebody doesn't fail to inhibit, then check where the dura attaches, the upper cervicals and the sacrum, basically. Start there, and usually you'll find significant issues in one of those two places. And when you find upper cervical, next step, the next logical step would be to ocular lock. Then you're going to be checking C2, C1, occiput, C2, C1, which is the upper cervical. And there's 7 times as many mechanoreceptors in the upper cervical muscles and tissue as there are in any other given area. 7 times. This area here has a lot more representation in the table. So, what about, has anybody been able to find the need for a low point with the did yesterday in the low points? We want to go over that again? I'd love to find one. Kind of found one on somebody had one that kind of acted like a 10%er. Someone come up who doesn't mind their acupuncture meridians being tested. Maybe anyone? We used to do these fine, but we can do it seated. We can also try the, oh, no, that too heavy. I will go with the pair of solution. Okay, so go ahead and pull off your, and, put your fingertips on those ones. One at a time. Middle pulse point, what is that? Liver gallbladder. Now go real light, superficial. Go deeper. Superficial. So the superficial one tests, which would indicate gallbladder, but let's have you lay on your back. And I'll test the liver and the gallbladder also. So that's right. So we don't. So PMS, not testing. Ooh, better check the wrong ones too. What am I testing now? Couplets. And lo and behold, both of them. And if you see this versus say some other kind of ankle test, watch right there. There. See how this tibial tuberosity will. That's a weak part. Sometimes that won't happen, and maybe the foot will let go. Well, that could be something else, a sore calf, or maybe tib burst. So that's an honest to goodness populate's weakness. So where's the alarm point for the gallbladder? Anyone? It's right below the one for the liver, right on the edge of the rib cage. And got both sides good, and touch that one first. But it doesn't seem to strengthen. It's almost, I go to the other side. Okay, so the gallbladder alarm point doesn't strengthen. That's perfect. That's what we're gallbladder meridian alarm point doesn't strengthen. Now what do I do? If you have it, notes, I go to the 24-hour clock and I go backward the 24-hour clock. Now, what meridian precedes the gallbladder? Triple. So, where's the triple warmer alarm clock?
Stage on 5, I think. Is that one?
It's right here, right below the belly button. 3 small bladders. So it's at the 3. So go ahead and hold that. So that's the alarm point for the triple warmer. And that does it. We only had to go back one. Oh, that's beautiful. Okay, we only had to go back one meridian. So now what do we treat? The low point, gallbladder. Allow the chi from the triple warmer. Where do we challenge and adjust? Challenge and possibly adjust. Triple warmer. It'll be below that. T12L1. Could be. Okay, so I'm going to challenge. Challenge. Yeah. Okay, so she's right at L1. Where's the tonification point? Oh no, I don't use it. I use the low point 37. Somebody tell me where that's at, so I can test it.
It's on both sides, so. Gallbladder meridian runs down the outside of the leg. Let's do this. There it is, right there. I'll make sure, yeah, so right there, there it is right there. So I could treat this with what? Laser? Gonna treat it with my laser. I can have it. And we're gonna have two of them, I think, here. Yeah, so I'm gonna treat both gallbladder 37s. Now, I think I got it right here. Double check here. Interesting, most of these points have a pretty small area. You can be just a tiny bit off. Sure. I don't know how long this is. I hold it for, if I'm really busy, I'll hold it for, 10, 15 seconds. It always seems to work.
You could also do like a
Yeah, if that's within your scope, yeah, you could definitely do that. That would be great. Put the needle there, then you can go on and do other stuff. I need a new battery. Let's see if now that actually, we haven't even done the spine yet, but that seemed to get it. So, can you lay face down? So we're going to challenge, we're going to end up finding the area that needs to be adjusted related to the triple warmer. We're actually adjusting the level that would be considered in excess. Okay, that'll work. Now, you may or may not be able to reach that. Can you reach that? Oh, look at you. Okay, that's pretty good. Okay, so that TLs. Now I'm going to challenge it this way, and this way, and this way, and this way. Okay, so that's the way. It challenges this way. Lay on your right side, please. L1s are tough to get. Side posture sometimes. What's going on? I broke it. So you chiropractors probably agree with me that L1 side posture can be tricky. Breathe in deep. Let it go. My vector is with my fingertips on her spinous. I'm doing a spinous pull. There we got it. Okay. Now, so we did that. We could do the love it. There. We didn't do nutrition. Can you TL again for me? No, I'm sorry, the pulse points. one at a time. Is that the middle?
That was fine.
Can you go to the middle? So, yeah, so I didn't get it. So what's up with that? Those are strong, so I can't use those now. Let's try the, push towards me. Yeah, so now those are gonna show. All right. That one's good. This one's not. Now, a skilled acupuncturist would probably be able to tell me where the energy jumped around to create this little surprise. But now I need to treat her liver meridian on the left and it strengthened to its own alarm. So I'm going to go to, somebody tell me what the tonification point is for liver. Oh, something I ate. There it is. Okay. So what's the associated point for liver? T910, which we were just there. But I think my battery's too low, so I'm just going to hold pressure on that. These little Taisheng things that, you ever use those? Anybody have one? You must have one out in the truck.
I'm sure
I have a bottle full of red light.
Oh, nice. That'd be cool, because, yeah. I mean, we might have it by now, but let's see. Let's see this. I should get through her.
Hands are a little too tight.
She's through there. Let's just do that. I don't know how long. There's somebody out there that would tell you exactly how long it will be. But I will let Els. So I'm gonna put pressure and use the line. Does this turn up? Try.
No,
It just focuses. Oh. Let's use it that way. So the acupuncture meridians, they use photons to transmit their information differently than hardwired nervous system, which of course uses electrons. So let's test the okay, go deep. Right. All right. Pull your shoes up. That's all right. Tie them. When I was a kid, it was you get in real trouble for taking your shoes off without untying them. My mother would get really unhappy with it. And nowadays, everybody does that.
Why wouldn't she get unhappy about it?
She'd get unhappy because she said, you know, those shoes cost money. And when you do that, it breaks down the shoe. That was her. Those shoes cost money. I mean, a pair of new Converse was about $9 when I was a kid. Seriously. And I would buy there was a Japanese made knockoff that was like $7. Those were usually the ones I would get. They seem to wear just as well as the Converse. Okay, so let's go back here. Yeah, they've gone up. For Converse?
really making me work here. So try that again, go on that point. Okay, so I need to adjust her T89. And I'm just going to do old school. Breathe in deep and let it go. Ooh, there we go. Breathe in again. That's it. Okay, good. Now, that one more time. Come back up and hold. Hold first. Good. Okay, now. Good, good. Hold. Hold. Now, there's something wrong with my testing muscle there. Do it again. Now, I think my testing muscle was losing. It was losing its strength. Yeah. So I just spindle that up and leave it be. Okay, good. Now one more time. Okay, good. Okay, thank you. Good. Yeah, other hand. There you go. Glasses. So that was another rather messy, convoluted example of using a 24-hour clock. We've had two examples that were both messy, but I was hoping for something a little more. But typically, the 10%er, you go back one or two meridians and you'll find your alarm. Then you treat gate point or the low point.
Oh, I think somebody's locked out.
Okay.
Oh.
Sorry about.
Oh. Well, they're down here now.
Oh, do we open it?
This won't go off. Will it? Welcome back. Okay, so how about TMJ? Everybody clear on TMJ? I'll go through the basic protocol from start to finish. So we test the TMJ without TL and with TL. We have two tools that we use on the muscles, closing and opening muscles of the T. Spindle down, vagal flex. The opening muscles, almost exclusively, the ones that we address will be the external pterygoid. Closing muscles are everything else. So, masseter, deep and superficial, internal pterygoid form the sling. They're the primary closing muscles. And the muscle that really put the force in the joint. And then the farther out muscles are the temporalis muscles, anterior, middle, and posterior divisions. Those muscles all close the jaw. Muscles that open the jaw are the external pterygoids, the suprahyoid muscles, which aren't very big, and gravity. So we start out by looking at the jaw. We look at deviation, right or left. We look at how much they can move the jaw. Power. It's really helpful if you ask a person to open their jaw, see if they can put 3 knuckles of the nose, which I just barely can. You guys? Three knuckles of the non-dominant hand. Also, you'll ask a patient to open, and they'll go like that. Open your jaw big. Like that. And they go, and I say real big, and they go. Or they go, I say retrude, and they go. So you find out how aware they are of what their jaw is doing. That's really helpful.
And then from, like, if they deviate to the right, you probably have, you have an imbalance of some kind in the way the muscles are. If it goes to the right, you've got a left external pterygoid, and probably a left anterior division of it, and possibly a right posterior division. All of those are possibilities. So you start out by testing strong indicator muscle after you've looked at the jaw function, how the patient bite down. If they weaken without any TL, check them for neurological tumor. Ask them if they recently had dental work or braces adjusted or any number of things, any kind of dental stuff if they had it recently. And then go in like we did, TL at the tooth gum line. And at some point you'll find one, you challenge it lingually, challenge it buccally, rebound challenge, basic respiration that negates challenge. That's how you treat it, just like a cradle. You press on it, a couple of pounds at the most, in the direction of challenge on the basic respiration. Once you've cleared that, and if they bite down and there's nothing, you go on to TMJ. The first thing you do is have them open big without TL. Something weakens, that means you stretch a muscle that needs to actually flex. You don't know which muscle yet. So you have them TL masseters, because it could be them. TL internal pterygoids, could be them, and temporalis. And one of those will show on one side. Then you narrow it down to, say, whatever it might be, say middle vision temporalis. You fascially flush that. It's basically effleurage. And once that doesn't test, i.e. strong indicator muscle does not weaken to opening and stretching, then you go to the next phase, and that's with TL. So before we were without TL, except we used TL to find the muscle, but we didn't have TL to begin with. Now we're TLing on the TMJ joint itself. Not the temporalis, not generally on the side of the head, but right at that joint. And you want your contact, patient's contact, to be pads of the fingers, at least 2, 3 is even better, right over that joint. It doesn't have to be pushing on them, just touching it. Now you're testing with TL. Strong indicator muscle doesn't weaken. You're not doing anything with the jaw yet. That's a good sign. If it does weaken, you might want to check your small intestine meridian. You're right at small intestine 19. Also, you might have a patient with hot inflammatory event happening around. Or they could have it could be any number of things. But if they TL without moving the jaw, then examine everything around that. Don't just assume that it's the TMJ. If it doesn't, now you bite down with TL. And that is going to indicate if you need to do a spindle down closing muscles. So, say you TL, bite down, indicator goes weak. Which side is it? This side. So on this side, you start going to the masseter, go to the internal pterygoid, go to the temporalis. We'll find which one negates that. You spindle that one down. Internal pterygoid is a little tough. You got to just kind of go in there and kind of sweep on the belly of the muscle best you can. Masseter, not too hard. You can spindle it down. Remember, you got 2 layers. You spindle down the superficial layer this way, deep layers a little more.
Hypertonic?
That's the idea. It's set too high. Its tone set is too high. It's hypertonic. Once that clears, you're still TLing, bite down, nothing. Then you TL and open. Now you're testing to see whether you need to spindle down on the external pterygoids. The external pterygoids are the ones that are contracting and activating. And that's where we go in with the pinky, gloved pinky, and go up in there and we push in the middle of that lower division of the external pterygoid I'll bring the jaw to that side to make space and do kind of strain, counter strain treatment on the joint while I'm doing that. Doing that. 4 or 5 seconds pressing. I'll have them breathe. I'll have them relax. Make sure they're not passing out. Sometimes it's breathing. And then you retest. TL and open. If that doesn't weaken the indicator muscle, then you can go. I mean, we can take it further and go and protrude, retrude, and then you get in, and you're going to usually find maybe problems with one of the other temporary. Take it further, but that's the basic protocol. That makes sense. Without TL, vaginal flush, spindle side. Spindle down, almost always. Now, that move I did with Dr. Charles, and somebody else I did that, where I get on. Now that's not really ICAK, AK stuff. That's my own particular approach. And I don't do any fast Yankee adjustments with the TMJ. Maybe there's people out there that do and they have good results, but the adjustments, I'm mainly trying to just find the motion back and forth, getting that glide. Because if you get the glide restored, that means that disc is now able to glide with the conduct. And if the aberrant stimulation of the receptors in those joints, if those are out of balance, that will often reset that system. We'll get the impulses firing better. A lot of times the hypertonic muscles are responding to this aberrant information coming from the exercises I give patients for TMJ are the lion pose, which is magical. If you have people who speak, who sing, the lion pose is just brilliant. Flushes the muscles of the tongue and the throat, opens up the TMJ. The other exercise I give them is I have them practice cultivating awareness about the position of the jaw. Then I'll have them do this jaw translation exercise. So what you're trying to do is just keep reminding the nervous system that this is your normal. This is your normal. This is your normal. But a lot of it is cultivating awareness of when you start building tension. And all of us do it some of the time. The key is to become aware of it. And when you become aware of it, then you can start making it. I tell people, make sure if they commute a lot, make sure you get into tight traffic. That's a good time to do your jaw exercises. That's when your jaw starts to tighten very often. So, any questions on cranium? Up to now. Glabellar fault. That one. What's it associated with? Glabellar. How about spinobasilar? What's the breathing pattern that you find with spinobasilar? So inspiration assist is your standard respiratory. And that's the first one we learned. Breath in, muscle turns on. Weak muscle, breath in, muscle turns on. You go to the mastoid on either side and you TL, one of those sides will need inspiration assist. All your only contact is the mastoid and just right into the sulcus. As the patient breathes in, if it's a breath in, press forward on the mastoid. What you're doing, if you remember the motion of the cranials, the mastoids move back and towards one another like that on inspiration. So what you're doing is you're actually standing in the way of that. As that bone should be moving this way, you're putting some back pressure against it, creating some spring. So it's a rebound correction. So that's the inspiration assist. That's the most basic one. Now, the next notch up is inspiration assist or expiration assist, usually inspiration, steno-basilar. And that's where you have this, plus you have the sphenoid kind of stuff. And with that one, remember you're addressing the area where the sphenoid and the occiput connect, spheno-basilar junction. And there's a flex point there. So as we breathe in, that sphenoid and basilar portion of the occiput, as we breathe out, it does that. So we're going to be pressing here and on the hard palate. We're on the hard palate, pressing up through the vomer, which is the vertical plate that goes into the spheno. So that's our lever. So for spheno-basilar, as the patient breathes in, we do the same thing here, but then we also press up on the beak. We're doing the same thing. We're sort of getting in the way of the normal motion, trying to build tension so that the correction will kind of do it itself. Now the way that you determine you have a spheno-basilar versus a regular inspiration assist is you need a forced inspiration. So it's like usually the way you find this is you've corrected an inspiration assist, but then it's going weak again. So then you try it again, and they breathe in and have them breathe in as much as they can, stay strong. Well, then you go to the spheno-basilar. It's like the notch up from the inspiration assist. Spheno-basilar cranial fault, often associated with category 2 pelvis. Now, the half breath in, half breath out, that's the temporal bulge and its counterpart, the parietal descent. So temporal bulge, well, like with the TMJ, and you look at the movement of the jaw as the patient opens and closes it. With the temporal bulge, you look at the patient's head, and a lot of times you'll see one side is literally kind of bulged this way, one side's kind of dim. And a lot of times they're not as obvious, but sometimes they're pretty obvious. And when you see that, then what you do is whatever weak muscle you found, and you can use a strong muscle, whatever weak muscle you found, have them take a half breath in, and they'll strengthen that weak muscle. A lot of times when we're doing respiratory corrections or respiratory challenge, find a weak muscle. One of the first things I do is I have the patient breathe in to see if that's going to make a difference. Now, usually I'll have them breathe in a normal breath. If that doesn't do it, I'll have them breathe in a forced breath. If that doesn't do it, and I'm still suspicious that it's cranial or craniosacral, I'll have them do a half breath in, especially if I've seen the bulge in their head. So when that happens, you've got a temporal bulge cranial. Half breath in strengthens it. Have them breathe the rest of the way in, half breath out, they'll weaken again, and that's going to be related to the parietal descent. Do you guys remember how to challenge a temporal bulge? You press here and here. So as if you were trying, if you know, it's bulge like this, as if you're trying to increase the bulge this way. Anyone have one? Anyone chronically have a temple? Charles, you kind of do. You might. Yeah. Come on up. We just worked on you. We just did something on you. We just did something on you a little bit ago.
For my abdominal pain, we didn't find anything.
Sclerogenic, we didn't find it. Have a seat, please. So, let's see if we have it. So I'm going to do, I use the TS line. Maybe you're kind of fixed for a while. So lay on your back for me. So that would most likely be a psoas. That point on the TS line. There's 2 points in a row that are psoas. So let's push it. Psoas. Okay. This is exactly what I was looking for. That was strong. Okay, so first take a breath in. Hold your breath. Push. Okay, so just breath in fixes it. Okay, breathe out. Breathe half breath in. Hold. Half breath in doesn't do it. Full breath in. Even more, like full, like speedal base. Yeah. So that's just a respiratory. That appears to be just respiratory. So I'm going to challenge back here. So breathe in. So I'm just going to do a basic inspiration assist on her temporal bone. Breathe in. Wanted a temporal bulge, but this is what I got. And once in the world. Okay. Now, the perfect thing would be if that holds out, breathe out. And it still holds with the breathe out. So breathing out, so we know we got it. So that wasn't a temporal bulge, but it was an inspiration assist. Thank you very much. Anybody else think you might have a temporal bulge? Somebody's got to have one. Charles, we'll check here and see. Okay, so breathe in through your nose. Breathe out. Good. Now relax your jaw and go half breath. Full breath in. Half breath. So yeah, we got lucky with that. Okay, so now, okay, if we look at your head. Sure. So nothing real obvious, but maybe a little bit, if anything, maybe on the right, but it's not. So what I'm going to do is I'm going to challenge. Here, I'm just going to challenge these. So half breath in. Put it leaning back. So he's got a temporal bulge on the right. Yeah, that was, I wasn't sure we'd find it, but that was perfect. So, my contact is going to be up here on the frontal bone and back here on the opposite bone. So I'm pressing through both of these bones to affect the temporal and parietal suture. So go ahead and breathe in. Now, they say have the patient breathe half breath in, which is what. But I find if you just have them breathe in, it usually works. So the parietal descent is going to be on the other side. And I wouldn't even necessarily challenge it. I would just treat it. So, and if you remember from whatever session we did that in, you're going to be pulling up on the parietal bone. You want this thumb to cross the sagittal suture. And I'll put my other thumb across here so I maintain sort of some traction to keep the sagittal suture from jamming. So I'm kind of holding that and then go ahead and breathe in. And on the exhale, I'm pulling up on his left parietal bone. In breath, and then on the out breath, out breath. And it's usually about that hard. I mean, that not hard. Now, what's this temporal bulge, parietal descent, radial pair relate to down in the pelvis? If the sphenobaselar relates to cat 2, what's the temporal bulge relate to? A lot of times you see a cat 1. Because remember, the category 1 is a torsion of the whole spine. So you got this going, you got this going. And a lot of times this is where you get the temporal, get a torque of this going. So half breath in, full breath in, half breath out, and full breath out. So that worked. Okay. Yep. Okay. That was a clean example of temporal bulge associated with category 1. Any questions on category 1? Someone tell me. Category 1. Somebody want to treat a category 1? I can talk you through it. I'm trying to see how we could best use this time since I got through all this. Somebody. Hey.
Okay, I could be wrong, but I'm going to try. My understanding of the category 1 and 2 is right? They were having a long leg and a short leg.
Yeah,
It's either one
both
way
of them have to do with pelvic distortion.
or the other. Yeah.
But they're kind of a different. The category 1, the whole pelvis is kind of torqued, but there isn't necessarily like a singular lesion at one SI, or that the whole pelvis is kind of like where the category 2 really is a subluxation of the sacroiliac. Like outside of AK or SOT and just regular mainstream chiropractic thinking, category 2 would be an SI fixation. Hip is out. My hip is out. That would be as far as I learned category 2s second, third year in chiropractic college, but they didn't call them that. They called them the SI fixation. See you in June. My best to Pluto.
I'll bring him next time.
Oh, cool. And your husband too, of course.
Okay, what's that?
I guess, you treat them both with blocks.
Treat them both with blocks. Category 2 is going to be treated supine. Now you can TL, come up here as I'm talking through it, I'll do it. So remember, category 2 is a one-hit TL. Okay. So go ahead and have a seat. Just do it that way. So bring this down here. Just put it in. Now, touch one SI. Test it. So there's something there, right? Stand up. And test the SI. Doesn't show standing. I'm sure you're right on that. It doesn't show standing. See. Shows seated. You'll see that a lot. It's really handy to treat people on their back, but that's not how they do most of their things. Is he seated or standing or something? So that would tell us we've got a category 2 on the right. Do we know if it's a PI? Do we know if it's an AS? We don't know. But it's one or the other. If it's a PI, what do we expect to see with the legs? One of the legs. Shorter. Leg on the side of the PI is shorter. Go. And actually, no, it's pretty. Yours is pretty under the radar because we didn't show it to you, sad. Okay, so we would expect a short leg on the PI side. We expect a long leg on the AS side. What would we expect with what they call the fossa test? Upper and lower fossa. Category 2 PI, upper fossa. Lower fossa, no. Upper fossa, yes. Nothing on the left side. So the upper fossa. So the third thing, remember UMS, upper fossa, medial knee tendons, and short leg. So once we found that, also a lot of times you'll find there'll be a weak iliacus. Along with other things, there'll be a lot of times a weak rectus on that side, which we're finding. There could be shuffling out, weak TFL, shuffling out, strong on that side. So there could be a number of other things that would be related. Could be adductors, adductor problems, piriformis. So everything on that side is kind of showing. Now that could be a compaction. So I'll do a quick stretch. Now, so while I'm examining it, well, maybe it's a compaction injury. It doesn't seem to be. So definitely a category 2 on the right. So how do we block it? Do I keep her supine or do I put her face down? Keep her supine. And then where's my blocks? Where? Ah. So how do I put my blocks? Here? Straight in or at an angle? Question? Yeah, okay. Okay, now what do I do with this one? Like that. Now what? Patience. I could come in here and go back to this upper fossa, see if that doesn't TL, and it doesn't. And then sometimes while they're cooking on the blocks, I'll come down, I'll make sure their legs are kind of free, and
I'll see, a lot of times this leg will lengthen right out as the blocks are shifting the pelvis back. Sometimes I'll have the blocks set too deep. And I'll go in here and maybe it's not clearing as quickly as I think it should be. Maybe the blocks are not deep enough, or maybe they're too deep. So it's good to kind of like stay with it. We're talking what, 30 seconds, a minute at the most.
Yeah, I wouldn't want it longer, like my heels, my low back and like this.
Yeah, yeah. And probably we could loosen these a little bit. Let's just see. Oh, you're cooked. So do I take the blocks out one at a time?
Never.
Never. Always say it. Okay, so go back to the upper fossa because it's so convenient. That doesn't test. That's good. And how about medial knee tenderness? Well, it wasn't really that. Short leg, it wasn't very short, but actually I think it did lengthen out a little bit. Now, sit up again, please. The way we found this was she was sitting and TL'd her right SI. Hold there. Please TL. Doesn't show. TL your left SI. But stand for me. And then so that was really a straightforward category 2, and kind of a subtle one because we wouldn't have found it standing. Probably wouldn't have found it supine because there's no stress on the pelvis for your supine. It's the least amount of stress. So thank you. Yeah. So thanks for asking because you're the one that asked me to clarify, and you probably knew it better than you thought. Now, what about category 1? You had a TL.
Face down.
Face down. And what kind of posture might you see with the cat one? Yeah. Head, pelvis, feet on the plumb line, but everything's kind of turned around it. Category 2 is head and feet on the plumb line, pelvis off to one side. Category 3, pelvis, feet on the plumb line, everything else off. The head is off.
And is that from the hips or is that just from?
Well, category 3 is where category 2 is technically an SI fixation slash subluxation. Category 3 is basically a L5 disc. Usually it's an L5, sometimes L4, L5 disc arrangement. L5 disc, a loss of proper disc integrity. So, but we call it, in SOT, they call it category 3.
Can you go over category 3?
Now, category 3 doesn't have a TL. Where cat 1 has a 2 and cat 2 has a 1.
We usually use the mastoid.
Did I teach you that?
No, that's from SOT.
Oh, from SOT, yeah. Yeah, I never learned that. So the way we do it in AK is we have you, basically you look at posture and then you, it's you have to challenge, you just go straight to challenge. So I can go through it if you want. Okay. Category 3. We have it, but we can kind of walk through it. Okay. Category 3 is a really nice thing. If you have a hot disc and you can't really use more, traditional adjusting on them, a lot of times it's a great way to get relief. So hold that right there. So I'm going to challenge sacrum, ischium, and sacrum and ischium. So with cat 3, you determine which side, and then you put the block is going to go straight in, just like a cat 2. Above, only the patient is face down. And then you're going to put the other block in just below the ASIS. That muscle is going to either stay strong or get strong. A lot of times the hamstrings start out kind of weak. You're going to ratchet this down until it goes weak. And then it'll re-strengthen. It'll go weak once and then it'll re-strengthen. If it doesn't, then move your block back up. Now you monitor the tenderness right here at this L5. And I'll usually have them breathe and just make sure I give the sacrum a little extra help. There. So those go weak again. That means they probably. Now you did have a little bit of it. Now I'm going to lift this, and I'm going to lift this. That doesn't show. So the first thing I did is I just reset the sacrum, and then the cat 3 you actually push the spinous and lift the opposite. So this is a challenge here, and this is a challenge here. And of course the block goes in this way. She doesn't have that, but basically what she had was sacral wobble, which, okay, so let's have you come up. So that's, for the test, remember with category 3, there's no TL. You have to go straight to challenge. And the posture will be like this. Sacral wobble. Sacral wobble. TL is like this, and basically you're checking for the sacral's ability to sort of nutate back and forth. What else is really key? Oh, sacrospinalis. I had a couple of you yesterday test the sacrospinalis. You did really good. We don't emphasize it enough because it's kind of inconvenient to test. But I hate to overlook that. That's really important. And you guys want to show that one. I want to show a few things that are ancillary to that. Face down, please. So sacrospinalis is, you're going to come up and test one side. And your testing vector is, you want to be on this side of the table. Stabilize them here. There. That, hold there. So that, hold, now breathe in. Okay, so there's a breath in, oops, sorry. There's a breath in component, come up this way, and hold. So that side's good. Okay, so how would we go about determining how to fix that? Well, the breath in fixed it, but is it in the brachylumbar, is it in the pelvis, or is it in the cranium? Is the breath component. Can you touch there by any chance? Without straining too much. I'll come up this way. Okay, so that's it. So then I'm going to go to here. So she's, let's try this side. And I'm going to challenge here. Yeah, so that whole side is
whole right side. Okay. So let's go in there and we're going to spindle it up. We'll see if we can get the muscles to override. Give it a little extra juice. Bring this up again. Maybe it's just the muscle itself. Push, push. No, it isn't. Okay. So let's have you TL here for me. This side, this arm. Oh, no, that isn't going to work. Okay, so go ahead and sit up again for me. So I'm going to go back to a strong indicator. I want you to touch right here. Something going on with the whole right side of her. Lay on your back. So what am I going to do? I'm going to test her Q out. Because that whole area is kind of pulled there. Q out. How you feeling? Are you feeling decent this afternoon?
Not really.
Okay.
Still real fatigued.
Yeah. Hold there. Okay. So how's your blood sugar doing? Is it... Oh, I'm sorry. God. You keep volunteering.
I do. It's all my fault.
We need to put caution tape around you to remind you. Okay, when I'm testing the QL. Okay. So go over here. Hold there. Okay. Something's going on. Did you get your stomach adjusted?
Yeah.
What's that? Just the right side, yeah. But for some reason, she TLs here. Is that tender? Yeah. You touch right there, right on that chap. You're going to need to adjust your thoracolumbar. There, yeah, that's. Okay, so what should I do next? Somebody tell me what to do next. We found a Chapman positive on her stomach. Right, QL. QL relates to the large intestine. Didn't check her ICB yet. We didn't check any other alarm points. We didn't check breath in. We checked breath in. Breath in, breath out. Breathe in. So she strengthens on her breath in. They want to just let you rest. Got it. Okay, hold there. So her ICV. So, sorry about that. Is that tender? So what am I pressing? Related to ICV. Is that tender? What was that? Bladder 58? Bladder 58. Kidney 4. Hit those points, and we'll reset the ICV. And breathe in deep. See. So I'm going to press up. Get out of harm's way. Breathe in deep. So I'm going to go right in and I'll pick up that ICV and bring it up towards the opposite shoulder. Breathe in again. And once more. Okay. Now, oh, big face down. Let's see if that got something else I want to do, but yeah, do that. Okay, so arms to the side. And this side up. There. Okay, good. So it's reluctant. That QL might have been
by it going weak, it might have caused these muscles to overreact. And maybe the QL is responding to these muscles. Try that once more. Just kind of flush them out a little bit. Squish. Okay, that's good. Okay. Whew. Okay, please rise. So check sacrospinalis and you'll end up down a rabbit hole every time. But that sacrospinalis, oh, I know what I wanted to show. There's one more thing I want you to consider playing with. Is this the right side? Okay. Okay, lay face down. And this is, did I pull these off? Sure. So doing a test like that, you're testing a lot of different muscles. There's all the different spinal muscles that sort of link together. So you're not just testing sacrospinalis or longissimus thoracis or thoracis or whatever it is. You're testing a whole series of muscles. I do the same thing with the glute, hamstring, calf, all the way down to the foot. And that right there, hopefully you'll be. So hold there. So that, now that's not strong. Okay, so bring this one up here. Okay, that one is. So the glute max is pretty good. Push, push. The hamstring's pretty good. Now push into my hand. So this is testing gastroc, hamstring, and if I brought her leg up this way, I'd be testing, you okay?
Yep.
See, there's no way. But if I test individually, a lot of times that'll be pretty good, and hamstring will be pretty good. And even this, I don't really like testing gastroc this way, but hold there. That'll test just perfectly fine. But we put them all together as if she was running, and this was the end of her toe off. So with your athletes or with your regular people or anybody else that'll sit still for it, first, I got to get this big muscle to turn on, this glute max. Now, I would do that with whatever means. I'm just going to see if it turns on from the O and I, because we've already adjusted a bunch of stuff on here. So that's pretty good. Now we'll go to the hamstring. That's pretty good in the clear. Now we'll see if the hamstring, while the glute max is able to hold, it says no. So where do I go next? Do I go to the hamstring, go to the glute max? Well, I have to go to both. This is where the magnet TL can come in handy. I go to the O and I of the glute max. I go to the mid belly of the glute max. I go to the mid belly of the hamstring, and there it is. Mid belly of the medial hamstring. That helps too, but really, this right here. So I'm going to spindle this up. This is just meat and potatoes muscle work. And bring this up again. So hamstring and glute max, not bad. Now let's put this, I'm just going to test hamstring and gastroc together. Hold there. Not so. Okay, so I'll go back into hamstring. Okay, so if I had my percussor, I'd probably come in and really flush this out. Spindle it up and then really flush it. Okay. And then I might have her contract that and push there to get the muscle to kind of flush itself out. Push. Good. I'll drop that down, push into my hand all the way. Keep going. All the way going. Good. More time. Push. This just pumps length. Okay. Now, let's try this again. Hold there. Push, push. Not bad. Not bad. Now, can she do it the whole kinetic chain? Push, push. Not bad. Not bad. Let's try this side here. Push, push. That one's still weak. Come up this way. Okay, so medial, I got lucky. Medial hamstring here. Okay? Got
wincing or
It's a little tender.
Or- speaking out. So I got a round head on my percussor.